Hello, I'm Rob Diller with DocWire News. We have a very special guest with us today, New Jersey Lieutenant Governor Sheila Oliver, and we'll be discussing New Jersey's plan to control COVID-19 as the state reopens. Lieutenant Governor Oliver, thank you so much for joining us today.
It's my pleasure, Rob.
Okay, thank you. And so here in New Jersey, we were hit extremely hard by COVID-19, to say the least, especially during the peak back in April. Now, we have turned the corner, fortunately, and we've seen a reduction in our infection and hospitalization rates. And as such, we started reopening. We did initiate phase 2 of reopenings as of last week. But as we go through these phase reopenings, what steps should New Jerseyans be taking to prevent a spike in the numbers?
Rob, I believe that for us to stay in the position that we are, if you look at the daily briefings that the governor conducts, our hospitalizations are significantly down, deaths significantly down, and the positivity rates are significantly down. So what is important is that people continue to follow the CDC guidelines. Wear your mask, honor social distancing, try not to go to large gatherings with a lot of crowdedness. And we understand it's now summer, people like to get out and about, but we've been able to contain this virus in New Jersey because of the social distancing practices that were put in place. We have to be mindful of that. And if you believe that you have been in an environment where maybe someone had previously had COVID, or they may have just recently been tested positive, you yourself should go have a test. But we have to continue the protocols we've been following since March.
And speaking of testing, which is obviously vitally important, how many diagnostic tests has New Jersey conducted thus far?
We have conducted 20, how many we've done thus far?
Yes, correct.
1 million. We've done 1 million tests, and give or take, a couple. But we are now doing about 20,000 tests a day. And by the end of June, Governor Murphy would like us to hit a goal of 25,000 tests a week.
And how about contact tracing? How important is contact tracing? And you want to talk a little bit about New Jersey, how it has been progressing in New Jersey thus far, contact tracing?
Yes, the epidemiologists told us from the beginning that one of the ways to contain COVID and community spread is through social contact, So we have entered into an agreement with the Rutgers University School of Public Health, and they have recruited and retained close to 800 contract tracers. And if I unknowingly had COVID, and let's say I've been at a school, or I've been to a large family gathering, or I've had dinner with my neighbors, it is important for the contact tracer to look at sort of like a family tree. Look at where you have been, people you have intermingled with, and the contact tracer has to then go ring the doorbell or make a phone call to those people to let them know they potentially could have been exposed to someone with the COVID virus, and it's important for them to get tested. And epidemiologists say that that is done for many contagious diseases, and it is quite effective.
And in terms of the policies and actions, can you talk, Lieutenant Governor, about some policies and actions that have worked thus far and some of the remaining challenges?
I think while it created a lot of economic harm, I think the fact that we, quote, put the state on lockdown got us to the place that we are. We daily tracked coming up to the curve, and we knew that once we got to that peak, we could begin to flatten things out. But I think it was extremely important to close down retail stores, shopping malls, movie theaters, indoor dining. It was those kinds of interventions that enabled us to get a hold on the spread of the virus. Closing schools, most of the universities in New Jersey, from the beginning, they voluntarily began to close their schools and to have virtual learning. because we could have had a nightmare on our hands in New Jersey if we had not done those things.
And this is a big one. I know as effective June 15th, child daycare centers are now open back up. What guidelines are in place to mitigate the risk of children getting infected with COVID?
The state has appropriated $20 million, and child care entities can apply to the state to receive grants. Those grants are for sanitizing facilities, doing what is necessary to social distance classes, training for personnel within child care centers, having the appropriate PPE for people that work with children in centers, daycares, and early childhood learning. So our Department of Health is working very closely with child care entities along with our Department of Human Services. The Department of Human Services oversees all child care licensees in the state. So prior to that opening on the 15th, you will see a different child care environment when you go there.
That's refreshing to hear. So this next one, and we're hoping this doesn't occur, but there does exist the distinct possibility that come fall, we will experience a second wave of COVID-19. What steps is New Jersey taking to prepare for a second wave?
Well, we think that we have pretty much gotten our population, the people in New Jersey, our residents, most of them are so familiar with the protocols. By and large, you see people masked up in New Jersey. You see people continuing to social distance themselves, even though it is hard to be away from your families. You know that many families have had to have no social contact with their elderly relatives because they are extremely vulnerable, people with underlying conditions. I think that those practices are going to continue. I think those practices are going to be embraced because our state was the second highest COVID infected population in the country, right after New York. We don't want to go there again. And I think those precautions that we're taking now, the governor began to slowly open up parks and recreational facilities. And last weekend was a weekend that was a quote test because we could do outdoor dining. And in some of our shore communities, younger people, as they were always used to in the quote old days, were congregating in small spaces, hundreds of people. And the governor has warned if people do not continue to heed those protocols, he is going to have to issue another executive order to prevent that kind of congregate gathering. So we're pretty much hepped up. I think if you go into most buildings in the state, as soon as you walk into the door, there is hand sanitizer there. Everyone is taking temperatures. Barbershops and hair salons opened on Monday, nail salons. It must be scheduled and appointment only. If you go into some of these places, you will see that there are plexiglass dividers between customers, and there is a plexiglass divider between a customer and the operator. So that's going to be the new normal in New Jersey. So those are the kinds of protocols that we have undertaken.
And lastly, Lieutenant Governor, is there any additional information that the public should know regarding the next phase of reopenings?
Commencing July 2nd, we have given authorization for the casinos to open up. And the Atlantic County economy has been the worst hit economy in the state. We know that unemployment spiked up to 43% in Atlantic City proper, and it was 33% around the whole county. The southern part of the state relies on the business that is generated from tourism. And we know that by opening back up July 2nd, maybe we can get people back to work. But the casinos can only operate at 25% capacity to get started. You will not see all the restaurants open within the hotel properties. and you will see physical separations by plexiglass in the slot areas and at the table games. But our next focus must be getting a jump start on this economy. We have suffered badly in New Jersey. I mean, really, really bad. And we have to get people back to work. But our priority in New Jersey is public health. And, you know, as we see it, you can always rebuild your economy, but you cannot bring back peoples whose lives have lost, and families have been devastated by this disease. So we continue to prioritize public health safety.
Well, Lieutenant Governor Oliver, you and Governor Murphy are doing a tremendous job, I think.
Thank you, Rob. I appreciate that. And, you know, I have to give a shout out all across New Jersey, healthcare professionals. They have finally been held in the esteem that they have deserved all along. Our medical professionals did yeoman's jobs, sacrificing themselves, sacrificing their families, and taking care of very, very, very sick people. And we appreciate all of our doctors and our healthcare aides and everyone in the profession, our hospital staffs, for helping us get through this pandemic.
Thank you so much, Lieutenant Governor Oliver. I know you're a very busy woman. I'll let you get on, but we really appreciate your time.
Thank you, Rob. My pleasure. Take care.